welcome to hello and welcome to Health Live at Seniors Today. I'm delighted to invite here today Dr. Rajan Bhonsle. Before I say hello to him, let me introduce him. Dr. Professor Rajan Bhonsle is honorary professor and head of the Department of Sexual Medicine at the KEM Hospital and St. GS Medical College in Mumbai. He is founder director of Heart to Heart Counseling Center and the dean of the Institute of Human Technology in India. He's a senior consultant in sexual medicine and a counselor practicing for over nearly 40 years. Dr. Bhonsle passed his MBBS from the Grant Medical College in Mumbai in 1981. He stood first in the MD examination of Mumbai University in the year 85. He's authored 8 books on sex education. This includes his international bestseller, The Complete Book of Sex Education, which I must mention here. There's also a chapter for on sex above the age of 60. And I'm sure this is something which Dr. Bhonsle is going to talk about. Dr. Bhonsle's book in Marathi is in its 12th edition since it was released by the Health and Education Minister of Maharashtra. He's also edited and contributed a Q&A book on sexuality, which was published by the news network NDTV. He's one of the co-authors of the book, What's the FUQ? Let me not pronounce it, in the way it could be, but frequently unanswered questions about sex, published by Lead Star Publications. This is the first ever book in the world that's been written by an entire family. So, Dr. Rajan Bhonsle, his wife, Dr. Meenu Bhonsle, and son, Dr. Aman Bhonsle, who was, a student of mine, not for too long, but and thus presenting a transgenerational layered and multifaceted perspective on matters and questions related to human sexuality. The book is on its way to becoming a bestseller in both Indian and international markets and is available on all leading platforms. Dr. Bhonsle started India's first full-fledged pre-marriage counseling center in Mumbai in 1998. And that's an interesting thing, and I've heard a lot about it. He has been giving lectures and conducting training programs and workshops in various national and international organizations, conclaves, forums, and distinguished institutes like the TISS, Bombay Hospital Institute of Medical Sciences, the Indian Medical Association, the Times Foundation, Government Law College, St. Xavier's University, etc. We are delighted to have here with us Dr. Rajan Bhonsle. Welcome to Health Live at Seniors Today. How are you, Doctor?
I'm fine. Such an elaborate introduction. Thank you very much, Pradyuman. You really made me feel special.
You deserve all of it. In fact, I had to edit it because it could just go on and on. But
Seems to be a network issue. For a while, your image was frozen, Pradyuman. Maybe there was a network issue.
I'm sorry. I'm going to, when the wrong things have to happen, the wrong things happen. So we are inviting Dr. Bhonsle to speak about sexual health concerns and advice for seniors. And Dr. Bhonsle, over to you for your presentation. And those of you who have questions, please put them in the Q&A tab. Because of the nature of the topic that is there, we will not take any names of the people who ask questions. They will be all asked anonymously. So don't worry. Please feel free to ask whatever questions you have, and we will pose it to Dr. Bhonsle. Over to you, Doctor.
Thank you very much, Pradyuman. And good evening to all of you, whoever is attending. Not that I am able to see all of you together in this kind of a setting. So am I allowed to share screen? Because I'll be sharing some...
Yes, you can share the screen. Yes, you can share the screen now.
Can you see my slides,
Yes,
Pradyuman?
yes, we can see it.
Okay, okay. So the topic given to me has two parts. First part is sexual health concerns of seniors. And second part is sexual health advice for seniors. The first part I'm calling it as aging related sexual dysfunction. First of all, because sexual dysfunctions is the correct scientific term and I'm used to using it. Invariably, the once you are 40 plus, the early signs of aging, while you are still middle aged technically, the early signs of aging begin. And as doctor, we always believe that prevention is better than cure. It is always wiser to start early. So, as I'm using the term sexual dysfunction, let me first explain what this term means. What is sexual dysfunction? Sexual dysfunction refers to a problem that prevents the individual or a couple from experiencing satisfaction from sexual activity. Very simple definition of sexual dysfunction. See, in 95% of the times, in any sexual medicine clinic, 95% of the time, people come with only three problems, and those three are put over here. One is premature ejaculation and erectile dysfunction, which is found in men, dyspareunia, which is found in women. And this is, I'm not talking about only senior citizens, I'm talking at all ages, at any age. And in rest of the 5%, there are other problems that people come to a sexologist. Invariably, a sexual dysfunction is just a symptom on the surface, and the underlying causes are multiple. Of course, I have given only 8 or 9 over here, but there are, you can say, almost 80 causes of various sexual dysfunction. And it is always the cause that we need to treat and not the symptom. For example, if 10 people come to me with having a problem with erection, and all 10 are of a different age, different citizenship, different countries, different educational status, different financial status. But the complaint is common. Let us say they all are suffering from, let us say, erectile dysfunction. They are unable to get a good erection. But with each one of them, the cause could be different. And as a doctor, invariably, we find out the cause. And it is a cause that is treated. And out of several causes that we know of, aging is just one of them. So, aging is often unnecessarily blamed for sexual dysfunctions. This lady, Helen Singer Kaplan, very highly respected by we sex therapists, she was the founder of the first ever clinic in USA for sexual disorders, and that too by a woman. That too by a woman. And look what she has said. The most causes of sexual dysfunction are not directly related to age, but rather other underlying medical issues. So let's not blame aging for all the sexual dysfunctions. As I said, there are predominantly three problems that we see in a sexual medicine practice. Out of these, two are related to men. So 95% male patients who visit sexologists come for these two sexual dysfunctions. One is erectile dysfunction, another is premature ejaculation. And again, this is irrespective of the age. I'm not talking about senior citizens here at all, but senior citizens included. So let's talk about the first one, which is premature ejaculation. Now, premature ejaculation is the most common sexual dysfunction in men. When it is as common cold. 1/3 of all the cases that come to any sexology clinic are of premature ejaculation. That common it is. And you'll be surprised to know that all men, with no exceptions, experience premature ejaculation at some point or other in their lives. Whether you are the most powerful man, not so powerful man, or you are an aam admi. All men experience premature ejaculation at some point or other in their lives. And look at it, what medical science says about it. There are no medical causes for premature ejaculation. It is a learned reflex response. We actually train ourselves into ejaculating early in growing years. And it is essential of a psycho-behavioral and relational in origin. What I mean by saying psycho-behavioral? That any strong negative emotion can cause premature ejaculation. whether it is anxiety, worry, fear, guilt, envy, stress, impatience, hurry, you just name it. Any negative emotion can lead to person experiencing premature ejaculation. The way you might have heard that acidity is because of hurry, worry, and curry. Premature ejaculation is invariably due to hurry, worry, and flurry. So let us not again blame aging for even premature ejaculation. Another issue that we see is erectile dysfunction. Now again, erectile dysfunction will visit every man at some time in his life. Erectile dysfunction means inability to achieve or maintain erection. And the age, of course, depends on one's genetic structure as well as the other factors that could be affecting a person. It is estimated that by the time a man in his 40s, he has about 40% chance of having some form of erectile dysfunction. And this prevalence increases about by 10% with each decade. So at 40, the percentage is 40%. At 50, the percentage is 50%. And at 60, the percentage is 60%. Masters and Johnsons, a very famous couple in the sense that they were married for just few years. Otherwise, they were married to someone else before marrying each other and even subsequently. But they did a lot of research, and we till today depend on a lot of research findings that they did. So what they have to say is that the risk of erectile dysfunction may increase with age because of naturally decreasing levels of testosterone. Testosterone, of course, is a hormone. It is a male sex hormone, you can say. But still, testosterone and age aren't the sole factors in achieving an erection. Again, erectile dysfunction, in 80% of cases, the cause is psychogenic. Psychogenic means it is arising from the mind. And in 20% cases only it is biological, or we can call it as an organic. So psychogenic erectile dysfunctions, when it is arising from your mind, irrespective of your age, is 4 times more prevalent than the organic erectile dysfunction. At a younger age, 80% type cause for erectile dysfunction is psychogenic, and it is only 20% organic. But as you age, the organic is 80% and psychogenic is 20%. More or less, prevalence remains just the same. Good news. Erectile dysfunction, the particularly organic one, does get worse with the age, but premature ejaculation gets better with the age. Aging literally helps. Why? Because with the age, you have more patience, more tehra, we say, more stability. Your emotional quotient also goes high. As against that, when you are young, you have that typical hurry, worry, and flurry, which is more common in youngsters. So again, let us not blame aging for all the sexual dysfunctions. So what generally is thought that sexual dysfunctions are more in elderly less than young. But if you go purely by the statistics at the sexual medicine clinic in the world, the number of cases that come to us with sexual dysfunctions, young people as well as old people, the findings are otherwise. We find sexual dysfunctions far more common in younger people than in elderly population. Why so? Because invariably the elderly people, once they age, you rest and relax more. You and your close ones take better care of your health. You give up or even reduce your vices. And you live more disciplined life. As against that, when you are young, they live and overwork themselves. They are often negligent towards their health. They are more into vices, bad habits, and they often lack discipline. That is why lifestyle diseases are very common in youngsters. That is why we can safely say that youngsters experience sexual dysfunctions much more than elderly population. So it is a myth. So yeah, and the truth is that young people experience sexual dysfunction more than elderly people. So as you are becoming senior citizens, it is not that with your age the sexual problems are increasing. It was other way around. So now I spoke about the 2 sexual dysfunctions in men. Now the only sexual dysfunction that we find in women is dyspareunia, which is pain during intercourse. Again, I would like to say all women experience sexual dysfunctions at some point or other in their lives. Again, a highly respected name, Alfred Kinsey, we call him as the father of modern sexology, and who did the systematic and scientific study of human sexuality. Look what his findings way back in 1950s say that about 43% women and only 31% men report same degree of sexual dysfunction. So even he identified that sexual dysfunctions are found more in women, while popularly we tend to believe that men tend to have more sexual dysfunction than women. Now, what happens as women approach menopause? Their estrogen, the main hormone, goes down, due to which they develop what is called as vaginal dryness and thinning of the vaginal lining or the vaginal mucosa, what we call as atrophic vaginitis, which then leads into pain during intercourse, because lubrication is extremely vital for a pleasurable intercourse. If there is no adequate lubrication, intercourse could be very, very painful for women. So when there is a vaginal dryness due to hormones, or estrogen goes down, and there is a thinning of vaginal mucosa, again because estrogen is less in their body, or sometimes it is so less that it cannot be even measured properly in blood tests. That leads into they experiencing pain during intercourse because of lack of lubrication, and as they experience pain is no more pleasurable, they lose interest in sexual intercourse. The same thing shown in this slide, that the reduced estrogen level causes dyspareunia, and that makes them lose interest in intercourse. Of course, it can be treated. We often treat it giving gels, hormone gels, where the thinning of the vaginal lining as well as the dryness is taken care of, and they can again enjoy sex the way you were enjoying earlier. Now, how we sexologists treat sexual dysfunction? The ideal way to treat any sexual dysfunction is to find out the cause, reach the diagnosis, and the diagnosis could be either cause could be organic or psychogenic. And in organic causes also there is a further classification, and we invariably find out the cause and treat the cause. So as said earlier, invariably sexual dysfunctions are only symptoms, and the underlying causes are many. Diabetes, which is shown on top, is one of the extremely common cause of person developing sexual dysfunction. And there is literally a pandemic of diabetes all over world, much bigger than COVID pandemic was, and particularly in India also. And I have written in my Marathi book that the diabetes is like a roganche mahadwar. It's a gateway to diseases, dysfunctions, deficiencies, deformities, and even death, if not treated. But if you can live absolutely normal life if it is detected early and treated correctly. Just because you have diabetes, you don't have to feel it's all over now. It's only I'm going to suffer as days pass. No. If it is detected early and it is treated properly, you can almost live a normal life. Diabetes doesn't come alone. It has a gang of its own. Invariably, diabetes is accompanied with hypertension, obesity, then there is a neuropathy, nephropathy. These are various medical issues that come up along with diabetes if it is not treated properly, even coronary heart disease. One more thing I would like to point out, invariably, almost majority of all antihypertensive medicines, all the medicines that we take for high blood pressure, themselves cause sexual dysfunction. Of course, not all. There are antihypertensives which you can take to control your blood pressure, and it will not affect your sexuality, it will not affect your libido, it will not affect your sexual functionings, erection, etc. As with the age, of course, there are many people experience benign prostate hyperplasia, called the BPH, prostate badi ho jata hai. That starts causing various urinary complaints, which is extremely and common in senior citizens. After the age of 50, it can always happen that your prostate grows and it creates problems with your urinary tract in various complaints related to urination start coming up. And then before doctor could even think in terms of operating on you, they invariably start you on medications which are called as alpha blockers. There are about 4 to 5 different alpha blockers are available in the market, which are prescribed to senior citizens whose PSA, which is prostate specific antigen, is high, and they detect that there is a prostatic enlargement. Sonography examination is done. There is, which is where the prostate is seen large in its size, as well as they have difficulty with urination. So they are started with alpha blockers, and most of the alpha blockers, except the alfuzosin, which I have marked over here, creates problem with ejaculation. So a person finds it difficult to ejaculate semen and ejaculate even experiencing an orgasm. But alfuzosin is the only alpha blocker which is common, which is equally good as compared to other. It can very well be given where it doesn't affect sexual function. So let's say anyone is taking alpha blocker and is experiencing at the same time difficulty with ejaculation. The semen doesn't come out when they, or it's very difficult to achieve climax and orgasm. They can discuss with their treating doctor that can you not give me alfuzosin as an alpha blocker, which will probably not create this problem related to ejaculation. So I thought I must talk about it. So as I have said it earlier, the ideal way is to first find out the cause and treat the cause. But even to treat the cause, first consult a genuine sexologist who has a qualification and experience. I will be surprised to know 80% doctors who call themselves sexologists in India are quacks. They neither have qualification or they have a fake qualification. When you will see these kind of advertisements, first of all, advertising itself is not allowed to medical professionals. The very fact that someone is advertising, that itself it means that either he has a fake degrees or then he's doing something very very unethical. But I'm not only talking about those doctors who have no qualification or a fake qualification. I'm talking about qualified quacks as well. This means they have a qualification, technically speaking, but their attitude is that of a quack. Who is a quack? Who doesn't have necessary knowledge, has an exploitative attitude, takes full advantage of patients' ignorance, innocence, and vulnerability, gives false and unrealistic promises, and focuses only on money. Unfortunately, large number of sexologists, practicing sexologists in India, are either actual quacks or their attitude is that of a quack. That is why it is necessary that you consult genuine sexologists with proper qualification and experience. What is good for sexual health? Remember, whatever is good for your general health and whatever is good for your heart is good for your sexual health. If you take good care of your health, if you do everything which is good for your heart, you are doing good to your sexual health also. For example, like balanced diet. Particularly as you grow, the diet should be low fat, of course low carb also if you are diabetic, and large number of senior citizens are diabetic. It should be high in fiber and it should be also rich in calcium and vitamins. Also going for a morning walk, not endlessly, just 30 to 40 minutes is always enough, and that to 4 to 5 times in a week. Of course, you walk a little longer or you go for a walk every day, nothing like that. But don't invariably tire yourself to such an extent that your knees start giving you a problem. So again, what is good for your sexual health? Same as what is good for your health in general. Number one is weight control. Because along with the age, if you are overweight, you are going to add trouble with your health at various levels. And it is not just sexual health. With any aspect of your health, you will have a problem if you are overweight. Balanced diet, which I already said, low fat, low carb, and high fiber diet. Regular morning walk, which will also help you to control your weight. 5 to 6 hours of sleep. More is not really necessary. If you are lucky enough to get more sleep than 5 to 6 hours, great. You don't have to have these 5 to 6 hours sleep at a stretch. Even if in the afternoon you have a nap of, let us say, about 1.5 hours or 2 hours, in the night you have a very less sleep, which is very common with senior citizens, that's good enough. Correct supplements. Often you require a calcium supplement, you require vitamin D3 and other multivitamins also if your diet is not good, or if your appetite is not good. Of course, which correct supplement should you take? It is better that you talk to your family physician who knows your health otherwise and take the correct supplement as per your family physician's advice. and regular checkups. You may not have required regular checkups earlier in your life, but now you require. Remember that. And if you take these 6 steps, not only your general health will remain good, your sexual health will also remain good. Of course, always stay well informed because knowledge empowers you. And that's why I have written several books. These 2 books, particularly, there are sections dedicated to sexual problems of senior citizens. You're most welcome to get them, they are available anywhere. It may sound as if I'm trying to do a promotion or selling my book. I tell you, I have written 11 books and they're published by all reputed publishers, but I don't accept any royalty from any publisher. All my publishers are given my book absolutely free because I told them keep my books cheaper, don't give me any royalty so that it will reach everywhere and everyone will be able to afford it. So that's I'm not trying to sell my book, but it's just trying to bring awareness because they are written with a lot of responsibility, with correct knowledge. Because otherwise, you go on internet, find out on Google, invariably you will get a mixed information, often a wrong information. And to find the authentic information, you need to read through authentic sources. That is why I was talking about. Thank you. I think that's more than enough.
Thank you very much. Thank you very, very much. I think it's been an amazing presentation and very detailed. Okay, I have a few questions that have come in, and I'm not, as I mentioned, I'm not going to take names.
Mm-hmm.
So there's one question which is asked. I think I don't know whether it's for you or it's for that. Is saying that are we too late for this subject now? So much gyan was good in the young days.
Mm-hmm.
What would you say, doctor?
Yeah, see, there I durustai. I say it in Hindi, at whichever age you can gain some knowledge, make some positive change in your lifestyle, bring some good habits, start taking better care of your health, whichever age, it is only going to help. One should not always, cry over spilled milk. If you have done any mistakes earlier, if you didn't access the knowledge earlier, it's okay. It's old story, but you can always look forward to living a better life with a better lifestyle choices, and that's all that matters.
Hey, doctor, there's an interesting question which has come in.
Hmm.
Uh, uh, this Dr. Bhonsle, this the issue about sorry, just one second. There's somebody. The issue about approaching a specialist like yourself is as much of pathological and biological as much as it's in the mind. Because I'm a little worried and embarrassed to approach a sexologist for my concerns because my entire family will come to know, and especially my children and grandchildren. How do I manage to meet someone like yourself?
Yeah, see, as we consult various specialists. As senior citizens, we go for eye checkup, we go for our cardiologist. So it's perfectly okay that you don't have to disclose all your details when you're visiting a doctor. You can always say, I'm visiting a doctor for some of my health concerns. They don't have to know which doctor and what is his specialization and all that. You can always ask for that kind of a privacy. And I don't think it should be that difficult. Of course, at each household it is difficult. Sometimes a senior citizen who is dependent on transport, dependent on money from younger generation, then naturally they will ask. But still, I think your seniority can command some kind of a saying, yeah, I have certain health concerns, and I found out the concerned specialist, and I would like to go and consult him. That's it. And then you consult. And moreover, my clinic, if you really go to say, I'm not talking come to me only. My clinic, there is nowhere it is displayed that is some kind of a sex clinic or there is a people come here for sexual problem, because my clinic is labeled as heart to heart counseling center. So people of all age groups come there. There are parents bringing their little kids over there who are having difficulty with studies. Then there are youngsters coming to me. There are young to be married couples come to me, young married couples to me, individuals come to me, and even senior citizens come to me. So as far as you visiting my clinic is concerned, moreover, beautifully my clinic is in a situation and positioned in a such a manner that even while entering the entire complex and entering my place, you get absolute privacy over there. Of course, that's I'm lucky over there. So it's about my clinic, but I think one should be bold enough to take help. And if anyone family member questions you, why do you require this kind of help at this age? Actually, it is none of their business. You are seeking help. The help is available, qualified specialist is available, and you have all the right to approach the qualified specialist to take his help. As far as I am concerned, I regularly see senior citizens. So if the senior man, even if let us say someone in his 65 70 comes to me and he says I have a erectile dysfunction problem, I'm not going to look at him at strangely, because I made hundreds of them earlier, much older than them also. And I've helped people with of that age with these problems. So as far as coming and talking to me is concerned, there should be nothing embarrassing. You get complete privacy when you are with me. And
Right.
if it is difficult for you to use certain terminology or to put your question in correct words, then I help them because I understand their difficulty. I can
Right.
switch to Hindi, I can switch to Marathi and help them to open up. Not everyone is bold enough to be able to say everything clearly, but that's the skill of a counselor. So I always say, before becoming a sexologist, you must become a good counselor. That's how I even mentor many of who come to me, that first get trained in counseling, only then learn sexology.
In fact, the another question that we've got is somebody who's complimented you for your presentation and asks, do sexologists take the help of psychologists if the psycho behavior is a reason for sexual dysfunction?
See, ideally, that's why I said qualified and experienced sexologists and not just sexologists. And as I said, unfortunately, many so called sexologists don't have any training in psychology, any training in counseling, any training in psychotherapy. I, in particular, am running an institute where there are professionals are trained in counseling through certificate courses. So I'm teaching that. So at our institute, I emphasize a lot on you yourself knowing about psychology, about counseling, various psychotherapeutic techniques like rational emotive behavior therapy, cognitive behavior therapy, transactional analysis. We use all these therapies in helping people having problems. So it is mandatory to be a really good sexologist to have a training in counseling and
Right.
thorough and proper training in counseling. If you are not trained in counseling and psychology, probably you will lack in your skills and you will not be able to help all your patients. That's what I say always to my students also.
Doctor, in your presentation, you had mentioned about, one of course are the quacks who are there, but you also mentioned about the qualified quacks,
Yes.
people who are perhaps you know have some qualification and who are giving incorrect advice. So the question that has come in is, what kind of um what kind of qualification should one be looking for from a sexologist uh, when one is visiting one in my city? And this is a person who is 67 years old and
Okay. See, first of all, we are all lucky. We are currently in a generation where Google helps us. Even there are many various other ways to find out the correct specialists. There are forums. There are ways in which you can find out the qualified sexologists around you. And invariably, all really good sexologists, successful sexologists, either have a website of their own or they have their publications. They have written articles. They have written books. They may be in a attached to a teaching hospital. Where, if on these parameters, if you examine them and if you see a certain person is of such an age and these are his, this is background and qualification, I think one could go there. Of course, nowadays also patients leave a lot of reviews of various specialists on Google and in many other places. So it's good to do research so that you can avoid going to a so-called qualified quack, or because even I tell you, internet helps us even when you are cheated. A doctor cheats a patient because it's also gets reported. Rather, reviews reveal that often, because I have seen it happening with many people in various specializations. So do your research. Better is to go by recommendation. If you trust your family doctor who has treated you for several years, it's good to ask him, do you know any good sexologists who you have referred cases earlier? You have a previous experience, and he may be a good person to guide you. Or then do a research on your own.
Doctor, you are associated with the KBM Hospital and GS Medical College. Now, Do our hospitals have trained sexologists whom one can approach?
See, many sexologists are privately practicing because sexology is invariably doesn't require anyone to admit. All other specialization will require person to get admitted and treatment with admission. People who come to us with a sexual problem usually do not need to get admitted in a hospital. That is why you will not see them attached to big hospitals. Hospital attachment is required when your patients may either require admission and critical care or surgery or something like that. Sexology practice doesn't need that. That is why they are not attached to big hospitals. But teaching hospital needs to have that. That is why KEM hospital is one of the most reputed teaching hospital. The students pass out their MBBS and their postgraduate degrees. That is why it is over there. Otherwise, other private hospitals, not all of them have attached sexologists to them, but there are sexologists who have their own clinics. Like I have my own setup. So you can always do little research who is best in your city. And if you don't find anyone best in your city, the problem is serious enough nowadays. You can even consult. Like I get cases from all over the world. Every week, I see cases from away from India, from different countries, different states, different cities of Maharashtra also. So nowadays, the way we are all here in one large group from different places, you can even consult sexologists over a Zoom call on a video consultation.
Right. Thank you. So, since doctors mentioned it, those of you who are interested can always contact Dr. Rajan Bhosle. At, his website is there. You just need to Google and be able to approach him. He is very easily accessible.
You type out my name and you will find it. Or otherwise I can, my last slide displayed that. My number is over here. Those who are interested can quickly note down. It is at the bottom of this slide.
So it is 98210 93902.
That's right. That's my direct number, which is also on WhatsApp. You can always, rather than calling directly, always write to me, Doctor, I would like to consult you. How do we go about it? This is simple, and I will be able to respond. You will get definitely a response on the same day.
Right. Yes, and I must confess to you that Dr. Bhosle is extremely responsive. And of course, those of you who are here and are aware who have led webinars in the past would be aware that uh, the edited extracts of this session will be on our site on Monday evening, as well as a testimonial, so you can have a look at that. Doctor, we have a question from another anonymous attendee who is a male, 68. He suffered a penile fracture about 20 years back, which resulted in partial ED. Now, due to prostate problems, he has been prescribed Silodo DB D8OD. Since the last 1 year, he's been on this medicine. As soon as he started this medicine, he is suffering from total erectile dysfunction. He's a cardiopathic patient, can't take Viagra or Cialis. Please advise.
Yeah. See, as he can't take Viagra because of the history of some heart issue, because invariably with the people with the heart issue, they could be given the medicine from the category of nitrites. And if someone is already taking nitrites, if he ends up taking something like Viagra, anything similar like Viagra, it could be even life-threatening. So of course, that kind of medicine is not given. How 20 years back this person who suffered from penile fracture, how exactly ultimately got treated, and at that time itself did it leave any sexual difficulty or sexual dysfunction with him, also requires to be known as a part of history. Because there is a history of penile fracture, of course if such a person approaches someone like me, I would like to examine this person to see is there any residual effect left on his penis, because penile fractures again could be a mild to severe. So that's another thing. Secondly, psilocybin that he's taking, which is an alpha blocker I was talking about, is a very good alpha blocker when it comes to a prostate problem, but it makes person impossible to ejaculate. Once you are on a psilocybin, you will not be able to ejaculate. Even if you masturbate or engage into sexual activity, it would take extremely long for you to experience orgasm. And even if you experience orgasm, if at all, the semen would not come out. So naturally, a whole life you have experienced the pleasure with the when the semen comes out, when you ejaculate, that doesn't come out. But invariably, the urologists who prescribe this medicine, psilocybin alpha blocker, they take into the consideration. Ideally, I tell urologists, you must take a sexual history. Don't presume that this person is, let us say, 65, 67. That means there must not be anything in his sex life, or he must not be sexually active. It's not fair to presume something like that. I ask all my patients that are you sexually active? It need not be that his wife is dead means he must be sexually inactive. No, people masturbate, self pleasure, we call it, and perfectly okay to even masturbate and self pleasure at any age, even at an old age. On the contrary, that could be one of the very good outlets at any age, including the old age. If you don't have a spouse, or let us say even if your spouse, because of the age, has lost interest, or she experiences a lot of pain, what we call the dyspareunia, because of excessive dryness or thinning of the vaginal lining, and you have a sexual desire, it is perfectly healthy and normal and completely harmless for a man even to masturbate. But even for a masturbation, if reaching your climax or experiencing orgasm becomes difficult because you're taking a certain medicine like psilocybin, then it is better to talk to your doctor and say, can I switch to, instead of psilocybin, can I switch to alfuzosin? Alfuzosin exactly does the same thing as psilocybin, but it doesn't affect your ejaculation. The man is able to ejaculate all over again. Of course, as far as this gentleman's erectile dysfunction is concerned, as I said, the causes invariably it is multifactorial. We will have to investigate this person to find out his cause of erectile dysfunction. To what extent his medications, to what extent his age, whether are there any other comorbidities like diabetes, is he on any blood pressure medications? Because I said 90% of the good blood pressure medications also affect your erection. So you may have to switch to a different blood pressure medication which doesn't affect your erection. So it will require history taking, knowing about all that's happening with this person along with these medications. It will require examination, it will require some investigation, and then he can be treated. It's not difficult. We have treated cases of this age with these kind of difficulties.
Thank you very much, Dr. Bhonsle, for being here. We have, I guess, given the topic that is there, we have limited number of questions. Some of our regular uh, askers are
Hesitating.
but I can understand. But all of you here, Dr. Bhonsle is, I can vouch for it, is as approachable as one would like it to be, and please contact him directly if you would like to. As he mentioned, you can message him and reach out to him. Thank you very much, Dr. Bhonsle, for being here, and we would love to have you, uh, you know, in our Seniors Today platform more. We are inviting you to write an article for one of our forthcoming issues. So we'll look forward to it. And thank you once again, Dr. Bhonsle. It was lovely having you there.
Thank you very much, Pradyumna. And
And
thank you
we
all
will
of
be
you.
back. We will be back once again next week, next Saturday at 5 p.m. Another session of Health Live with Seniors Today. Before we go, I would request our producer to play the video of the latest issue of the magazine, which is out on the 15th. Feroz, can you play the video? So, Dr. Bhonsle, this is our latest issue of the magazine, which is out on the 15th. this is Seniors Today magazine. Our Evergreen Club app is there where you have a host of programs every day, morning, afternoon, evening. So please, if you haven't downloaded it yet, you must download it. There are quite a few interesting events which are there. Our, the other flagship event which we have, Seniors Have Talent, has just finished its 14th season, and the 15th season is going to start from June. So if you like singing, by the way, I must mention here, and I forgot to mention it in the CV, is that Dr. Rajan Bhonsle is also a fantastic singer, and so Dr. Bhonsle, if you have time, would you like to end this show with a song, just without any music?
प्यार करते करते बिछड़ जाए कहीं हम मगर और सुनी सी लगे उन्हें तुम्हें जीवन की ये डगर हम लौट आएंगे तुम यूं ही बुलाते रहना कभी अलविदा ना कहना कभी अलविदा ना कहना.
Fantastic. I must mention here. I think we must have one, and Feroz, our producer, is also here. We must have a special session, not a contest for doctors. With doctors, we've had quite a few doctors
Who
in Seniors
sings?
and Talent. Somebody like yourself, I know Dr. Mukesh Bakra he enjoys the singing. There are quite a few other doctors. We must have a special session with just doctors,
Why
right?
not?
And we
Yeah.
will, love to have you there. Thank you very much, doctor, and lovely having you.
Thank you. Thank
Thank
you.
you.